thank you very much for this opportunity to contribute to this important discussion on mHealth today on behalf of the GSMA. The GSMA represents the interests of mobile network operators worldwide and unites in total, I think, more than 800 operators with some 250 companies in the broader mobile ecosystem. So I'm very happy to contribute on behalf of the GSMA today. Overall, I think mHealth, as was mentioned before, is a very topical theme. It's being discussed at the moment a lot at different levels. And I think also looking at the mHealth Green Paper, which was published by the European Commission last year, and was mentioned by previous speakers, there seems to be overall recognition of the potential benefits mHealth can offer to patients, healthcare professionals, and healthcare systems. Also, and I'm building on what other speakers have said, there's still barriers at the moment and many questions which need to be addressed in order to unlock the benefits and to ensure successful deployment of mHealth across Europe and to ensure that users actually have access. And this also has become clear in the Green Paper, of course. So what I would like to do is highlight some key themes and some points which we feel, and some of them have been raised by previous speakers. They're also reflected in the Green Paper and the related consultation results, which have been published very, very recently and which will be addressed, I guess, later on. So some themes which we believe are important to look at when working on the follow-up to the Green Paper and related consultation. So the first point or theme I would like to highlight, and again this was also mentioned in the Green Paper and the consultation results, I believe, but we believe it's a very important one, is building trust and confidence. And of course this theme has different important points linked to it. The first point I would like to stress, also following up on what Constance said, is data protection and privacy, a very important point, very difficult one as well. And many of the questions relevant to mHealth and data protection and privacy have been and are being discussed in the context of the proposed general data protection regulation. The GDPR. One specific challenge I would like to flag here is the need to address crossing and blurring boundaries between EU legislation relevant to data protection and privacy, such as the GDPR I just mentioned, and the e-privacy directive, the proposed network and information security directive, so the need to coordinate between all these relevant pieces of EU legislation. Some of them are on the table at the moment. Different stakeholders have taken initiatives in the area of data protection and privacy, and we believe it would be good and very interesting to look at good practices in this area, some of the initiatives which have been taken by different stakeholders. The GSMA has worked over the last few years on different initiatives, such as mobile privacy, GSMA mobile privacy initiatives, privacy principles and privacy design guidelines for mobile app developers. So promoting and sharing, finding a way to share these initiatives and perhaps good practices could be useful. A second very important point, we believe, under the heading of building trust and confidence, this was mentioned already by one of the previous speakers as well, is the need for regulatory clarity and legal certainty with respect to mHealth solutions, clarity with respect to the application of medical device regulation to those mHealth solutions which should be considered medical device. mHealth includes a range of different types of solutions, the ones with a clear medical purpose, but also this is being referred to a lot, the lifestyle and well-being solutions. overall, we would like to propose a proportionate and risk-based approach, as has been developed and applied in other parts of the world, like the FDA guidance for mobile medical apps, which I think has been received quite positively by all stakeholders involved, and which explicitly does not include lifestyle well-being apps that may not need the same level of regulatory oversight. And again, it's about finding the balance, which isn't obvious. And then another point I would like to mention with respect to the application of regulation and raising regulatory clarity is that it would perhaps be useful, and this was mentioned already as well, I think, which I was very glad to hear, to work on and try to agree on definitions of some key terms, because it's a complicated debate. Some issues are very technical, and it would help if there's clarity around certain terms, especially terms which are being referred to a lot, like lifestyle and well-being apps. It's not entirely clear often what is meant by these solutions. Then moving on to some additional headings, and I will try to speed up as well to leave sufficient time for discussion. And yeah, in a way, most of these themes are linked to building trust and confidence. But one thing we find really important as well is raising mHealth awareness and skills, and I think this has come up through different EU projects and related reports as well, the need to encourage mHealth education and awareness, and this could perhaps be done through different EU programs, and some initiatives have already started, I think. Inclusion of mHealth in programs for medical students, which is, I believe, often not the case at the moment. Funding and reimbursement, also a very difficult one, but nevertheless an important one. We believe it would be good to promote new innovative funding models based on health outcomes. Not all national healthcare systems in Europe at the moment recognize eHealth or mHealth, so it would be good, and I believe this was also included in the consultation results, to find a way to exchange information and examples of current good practice in this area. Improving interoperability, another important theme, and here I would like to refer to the very good work of the Continuum Health Alliance in this area. Stimulation of adoption of core interoperable standards, and I think it would be good to stimulate more work in this area and to recognize the work which has already been done. And then the last point is the need to coordinate at global level, the need for international harmonization and cooperation. There are discussions going on in of course, in other parts of the world, but also in international fora like the IMDRF, Medical Device Regulatory Forum, and it would be good to align, as the mHealth sector has a very strong global dimension, to try to align with these developments. I think I would like to leave it at this. These are, as I said, these are headings. They need a lot of detail, a lot of discussions, but I really hope today is the start of a very constructive process involving all different stakeholders, working on the follow-up to the Green Paper consultation. Thank you very much.